Okay, this is Stevi. She's a 7-year-old mare, and she has had some suspensory soreness. So today we're going to check to see if she is sore in this left front suspensory, and then we're going to do some treatment, whether she's sore or she's not. We did have an ultrasound of it. It is not torn, but it is inflamed. So we're going to do some work on it. So we're going to pick up her foot. And with the suspensory, you want to rub right along that bone. And she was real sore up in the upper part, so she's really not showing any soreness today, which is a good thing. I also don't feel any thickening of anything in there. So I think the things that we're doing with her are helping. So some of the stuff that we are doing with her are microcurrent. And today we're going to add laser. And we've also done therapeutic ultrasound. So I'll show you all those things today. Okay, so we have the laser that we use. It's a multi-radiance Activet, it's called. And we're gonna use program 4, which is for inflammation. And we could use program 6, which also helps with pain. But we're going to probably just use program 4 on the inside and the outside of that suspensory ligament. We'll do 2 minutes program 4 on the inside and 2 minutes program 4. You can see the red light is going. And we're just gonna move it slowly up and down. She was very point tender to the upper part or the proximal part of her suspensory, so that's where we're gonna focus the majority of our treatments are right on this upper part closer to her knee. Okay, and this is the microcurrent unit that we're going to put on her leg. I'm not going to do ultrasound on her leg today because she's really not all that sore. So we're gonna put some microcurrent on there, and so this is good for sprains, strains. I've used it on myself after I had horse step on my foot. Had 0 pain the next day. We use microcurrent in the physical therapy clinic for ankle sprains, and so this was the first thing that I put on her when we found that she had the problem, and the next day she had 0 tender disc palpation, so it really helped quite a bit. And we'll put it on each side of where she was sore. Okay, so here it is in place on her leg, and you can see the red light is blinking, so that tells us that we have good contact with the electrodes. I'll probably cover that with some rock tape or kinesio tape to keep it in place. The other issue that Stevi has going on is she has some pretty significant back pain. You can see as I palpate right through here, her back muscles get tense. And she's that way on the other side as well. So we're gonna do some things to help her with her back pain. I hold my laser up by the light head instead of on the handle. I feel like I can get some downward pressure with that. So if you're wondering why, it's because I feel like I get a little bit of a little bit of a massage with it too when you get that downward pressure. I don't know if you can hear it or not, but a real high pitch when you get to this. This is now program 6, and this is more for pain. And maybe you can hear it when I get close to it. You can see she's releasing like crazy when we're doing this. Okay, so here's her back muscles after the laser treatment. Not nearly as reactive. So And she pretty much wanted to fall asleep during that time. So I'd say that they're a little less painful. So that's good to see. We'll do some other things. We'll do some instrument-assisted soft tissue mobilization as well, to loosen up those back muscles too. And then we'll do some joint mobilization. This is one of my Graston tools, and I use it for instrument-assisted soft tissue mobilization. It is good with horses because otherwise I feel like you kind of wear out your fingers, your hands, your elbows. It gives you a little more leverage. And you can really help those soft tissues with it. So I'm going to work on her low back with that, or her lumbar spine. I don't know if you'll be able to see, but I'm using the knobby part over that area, over those muscles that are tight and tender on her. And then I like to work into the hips. You can see she's releasing both of their lips and her passing gas. As you can see, there's still just a little bit of tenderness right through there, so we'll work on that yet. I feel like it's worse over here on this right side than it is on the left side. The tools are nice, but a lot of times you got to get in there with your fingers to really know what you're feeling. You can tell she's tender there. We found out she's really sore right here. Got the rest of the muscles pretty much calmed down. I'll just go through and do some joint mobs.